Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Many women desire to breastfeed and want to make sure it's a positive experience. Today we will be talking about everything you need to know early on to help make breastfeeding a success. So click those like and subscribe buttons and stay with us. So the first thing that you should do in order to help breastfeeding be successful is to take classes. Breastfeeding is just like any other skill out there. The more you learn, the more successful you'll be at it. So take lots of classes to show you what breastfeeding is going to be like, positions you can use, and the like. Find your local support groups in the area. These will be key to your success because when you're having issues, it's nice to be surrounded by other people who may have gone through what you're going through. Find your local lactation consultants. That way, if you need some extra hands on deck, you'll know where to go. And find out the breastfeeding friendly hospitals and providers in your area. It goes a long way to have a healthcare provider and hospital who supports your decision to breastfeed. So to make breastfeeding successful, you need to make sure you have the right breastfeeding supplies. The first is a really good quality nursing bra. These bras can help support you when your breasts are full, and sometimes they'll even double as a pumping bra if you're going to be pumping. You also want to get good nursing pillows. These pillows are designed to help support your arms and your baby to make positioning of the baby easier during breastfeeding. Make sure to get breast pads because once your milk supply comes in, you may notice that you're having a little bit of leaking. And finally, breastfeeding is not always comfortable in the beginning. In fact, I often tell patients it is normal to have a little bit of pain because you're getting used to a skill, a new thing that you had to learn how to do. And as a result, you may have some damage to your nipples. So make sure you get a high quality lanolin cream. Now, there's tons of different organic versions and natural versions, but I will tell you, and most lactation consultants will tell you, you want to get just pure lanolin cream. You don't want to have anything that has any extra perfumes or ingredients because those could cause an allergic reaction for both you and baby. Additionally, you could use organic coconut oil, but make sure you get it in a glass jar. Also, consider investing in some comfort gels. These are gel pads that you can place on your sore nipples if the damage gets too severe. They're super wonderful, super comfy, and well worth the money. Birth is one of the first moments where you can start breastfeeding off to a good start. So after your baby is born, you want to request skin to skin. This is where baby comes immediately from delivery straight onto your bare skin. Skin to skin is exactly how it sounds. There is no shirt on mom, no bra, and baby has nothing but a diaper on. You place a warm blanket over the two of you to keep the baby warm. Now, you want to start to breastfeed as soon as possible. Allow your baby to lead the way. When you start to see feeding cues, you want to go ahead and try to latch your baby. Insist that you breastfeed before the baby receives any medications unless the medications are life-saving. So erythromycin ointment and vitamin K and hepatitis B shots may all be important medications, but they are not life-saving medications and can be delayed until after the first latch. Finally, don't pass your baby around a lot. This is very tempting. Everybody's so excited to see the baby, especially your partner. And you may want to make sure everybody's getting a chance to hold the baby. But this is actually very detrimental to breastfeeding and can really disorganize the baby and cause them to shut down and stop latching. Please remember to hit the like button and subscribe so you can get our latest content. So, natural breastfeeding is how newborn babies were meant to breastfeeding. This is also sometimes referred to as laid back breastfeeding. This is where mom breastfeeds in a reclined position with baby on top of her. The reason why this position works is because, first of all, moms are recovering from birth. When you lay back, you take pressure off of a C-section incision or you take pressure off of the vaginal area, both of which can be sore. Second, human beings when they're born have a series of pressure points on the fronts of their bodies. When we lay that newborn human onto its mom, we trigger the rooting reflex. This is where the baby opens his mouth wide to try to search and latch onto the breast. Make sure that if you are doing laid back breastfeeding, that you allow the baby to latch from both sides, especially early on. This will stimulate a good milk production. It also helps both you and baby practice. So it's really important that you understand and recognize what is normal during early breastfeeding. One of the most normal things that happens is babies like to cluster feed. This means they're feeding lots of times during the day and sometimes for long periods of time. The idea behind this is it's going to help to stimulate your milk supply and help feed your baby better. Now, you want to make sure you understand what your baby's feeding cues are. A lot of people think babies are hungry when they start to cry, and actually that's the worst time to try and breastfeed a baby because they're so disorganized. So instead, look for those early feeding cues. They can be as simple as your baby wiggling around a little bit in the crib. They may try to put their hand to their mouth, even with their eyes closed. This is still a feeding cue. They start to open their eyes. They may smack their lips. And the last thing is they may open and close their mouths. These are all signs that you should pay attention for that lets you know baby is ready to breastfeed. Our last tip for early breastfeeding success involves the recognition of the most common early breastfeeding complication. This is engorgement. Engorgement is when you have too much milk in your breasts. This results in a very hard, painful breast, and it can be so hard and painful that the milk actually won't come out. So it's important to recognize this because if you don't treat it early enough, it can lead to mastitis, and mastitis can actually lead to a systemic infection requiring antibiotics. So when you start to notice that your breasts are very full, hard and painful, the things that you can do for them are the following. You can use some ice. Now, ice inhibits milk production, so you want to be careful with this if you are breastfeeding, but you can go ahead and use ice for 10 to 15 minutes a couple times a day. What's more essential is massage. You want to go ahead and massage that painful breast. Soften it up because then the milk will release and come out. And finally, you want to hand express some of that milk to help relieve the pain. You want your baby to be breastfeeding as much as possible during this time. So if you express too much milk, you're actually telling your body to make twice as much milk. So try to leave most of the milk expression for your baby's latch. I hope this video has helped you prepare for early breastfeeding. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like button and subscribe so you can be the first to receive the latest information in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.